Good afternoon, everyone. Welcome to Perspectives in Conversation, our last Perspectives of the year. It's my great pleasure to have you all here attending this afternoon and to have a terrific panel who will be engaged in what I know will be a fantastic discussion. My name is Jennifer Phillip and I'm the Chair of Palliative Medicine at University of Melbourne, St Vincent's, and also in collaboration with the Victorian Comprehensive Cancer Centre Alliance. And it's on behalf of my team, Palliative Nexus, that we are hosting you here today. I'm really excited that we are here today, and I guess for our last one of the year, in our third year of running these, our tradition is to have a panel discussion. But before I introduce you to the panellists, I'd like to take a moment to acknowledge the traditional custodians of the land. I'm on the land of the Wurundjeri people of the Kulin Nations, and I wish to pay my respects to the elders, past and present, and also to acknowledge any Aboriginal and Torres Strait Islander people who are part of this discussion and this meeting this afternoon. Today, as our last session for the year, I am proud to be hosting a panel discussion, and we've chosen the theme of endurance, which I'll explain in a moment. But to begin, I'd like to introduce our panellists, and perhaps we might stop sharing the thing so that we can have people full screen. Thank you, Tanya. So if I could first of all introduce Nicola Gorwell. Nicola is a registered nurse and endorsed nurse practitioner since 2017. She's over the past 25 years, more actually, worked in varied roles across inpatient and community settings, both metropolitan region and remote in Victoria and New South Wales. She's currently employed as a nurse practitioner coordinator at St Vincent's Hospital in the Palliative Care Evaluation Unit. In last year, she was awarded St Vincent's Health Inclusive Health Innovation Research Endowment Fund Award to conduct an evaluation of St Vincent's Community Connect model of evaluating care for people experiencing vulnerability. She's also been the recipient of the St Vincent's Melbourne Chief Nursing Officer Award for Nursing Excellence. So welcome, Nicola. Can I next introduce Danielle Spence, who has been very cool under pressure because our IT let her down. So Danielle is an internationally recognised leader in cancer policy and advocacy, which builds on her extensive experience in cancer nursing. She has a track record of effective and impactful strategic leadership, having worked as Director of Policy and Advocacy at the Breast Cancer Network Australia, where she led a series of research and advocacy agendas, delivering national and international advances to support women living with breast cancer. Since 2019, Danielle has been Head of Strategy and Support at the Cancer Council Victoria, and in this role, she and her team work closely with government and at the interface with health services, ensuring that the Cancer Council is really ideally positioned to develop, implement and lead prioritised cancer control programs to the benefit of the Victorian community. Welcome, Danielle. Philip Lee is a GP in Western Sydney, worked for over 20 years, and in the last 22 years, subsequently worked in his clinical career, worked as a palliative medicine physician at Westmead, St Joseph's and Blackdown Mount Druitt hospitals. He's also Director of Western Sydney Local Health District Supportive and Palliative Medicine Department. He retired in 2017 and has since been volunteering as a consumer representative for the local Sydney Health District, Consumer Council, Western Sydney Primary Healthcare Network, the University of Sydney Palliative Care and Cancer Symptom Trials Groups, and the HETI, which I'll have to get you to explain to me, Extenuating Circumstances Committee, reviewing appeals of new intern allocations. He's a palliative care advocate, highly effective, promoting community education around palliative care and encouraging improved government funding for palliative care in Western Sydney and indeed across New South Wales. And finally, Michael Chapman. So Michael's a geriatrician and palliative medicine physician who works at the as a medical director of palliative care at Canberra Hospital. His academic interests including using systems thinking in healthcare, clinician self-care, palliative dementia care, and the integration of specialist palliative services into aged care and quality of dying in the acute settings. He has roles with multiple journals and universities, and he's chair of ANSPAM Special Interest Group responding to COVID-19 and sits on the National COVID-19 Clinical Evidence Task Force panel focused on ageing and palliative care. Welcome, Michael. So, and all my papers, I've just lost where I was. So, we've taken the theme of this panel discussion to be endurance, and you might wonder a little bit about this, but in reflecting on the year, and there's been great achievements and great things have happened, and there's also been a bit of a sense around the place of things being a bit of a slog, particularly perhaps in the last few months. And, you know, it's interesting to reflect why the pandemic, you know, hasn't gone, even though the discourse and the sense of urgency in the public arena is perhaps a bit less. Climate continues to throw lots of challenges and indeed crises, and floods and more floods have gripped the country, our country, most recently in the last 12 months, I guess. The war in Ukraine, the cost of living felt acutely across the community, and particularly as we approach this part of the year. So we are feeling, I guess, this sort of omnipresent anxiety, and how much more for the people who are needing care, needing palliative care, and their families. So how do we respond to this? And so we came to this theme of endurance. And you might think endurance is a bit ho-hum, a bit dogged, and that perhaps we should have gone resilience, but just take a moment and bear with me, and I'll explain why. So if you look at the origins of the word, resilience comes from resiliere, which means to leap back, recoil, return to the original position. Endurance is a bit different. It's a bit more around, it's from the French, endurer, to withstand, to continue, to exist in time, to last, and to hold out, including at times of repeated stress. And I think it doesn't necessarily mean returning to the original form, which is perhaps where there is, you know, some notion of adaptation potentially, possibly even a kernel of growth. So in thinking about that, and I'm wondering if I could ask perhaps each of you to comment from your perspective, from where you sit on this notion of endurance and what you've observed or reflected on in the last year. And perhaps I might go to you first, Nicola, if that would be all right.
Thank you, Jenny. Thank you for that introduction. I suppose when we look back at the beginnings of this, it was the beginning of 2020, and we had those devastating bushfires along the eastern seaboard that were beamed across the networks in photo print. And I think for some of us too had first-hand experience of that. And then in January the 25th, we had our first case of coronavirus recorded in Victoria. So I think in a really short period of time, we had these major events. One, we'd already bared witness to the catastrophe and that was unfolding, and the other was this impending sense of something pretty awful that was coming. And I think for a lot of us, there was that awful sense of fear, really, a fear of the unknown. And then for health clinicians, it was that concept that we had an enormous thing unfolding here, and that we had to enact, you know, very, very rapidly and very, very quickly a plan to address this. So I think for me, during that period of time, it was that just the main thing was that overriding sense of fear. I think that was, and then really at that time, really wanting to run away and hide, not to be a part of this. But then we had this huge lot of work that we had to get through. And at the time, the enormous fatigue that was being experienced across, and exhaustion that was experienced across, you know, for everyone, but I think particularly for health clinicians. And I think when we look at those challenges, it is, you know, how did we move through that? You know, how did we, when we confronted that, move into that next to be able to enact a plan? And I think often it is that we sort of go in blind, and it's that feeling when you have something that you're really going to fear, that's fearful, we kind of, you know, go in blind, we just go full bore through it and hoping we'll be okay. And it's not until we look back and we open our eyes again, we can actually reflect on, on what's happened. And I know we still have, it's part of our day-to-day practices, but again, the threat is not so imminent. And just looking at those challenges, that were the major challenges. And I think in palliative care as well, it was the challenges we experienced with families, particularly with the visiting restrictions, and then also with the restrictions on gathering. And I think for a lot of us, there was enormous despair during that time, and was felt very, very acutely. But then I think, looking back, when we look at the positives that did come out of that we were able to rapidly mobilise the workforce to really address this, and it was quite extraordinary. And also the ability to keep adapting and changing that environment. And also, even during that time, it was just getting resources to be able to deal with this, and how we've managed to very much, revolutionise healthcare. When you think of telehealth now and Zoom, how we're going to go about it. So there was a lot of creativity and a lot of collaboration, the camaraderie and the new friendships that were formed during that time. So, and from patients' perspective too, it was often, there was periods of deep, deep sorrow and distress, but there was also those periods when people were reunited, so glimmers of joy and hope. So I think it was riding that roller coaster and how we move through that fear. And often it is like the blind leading the blind, and it's a mad dash, because it was a mad dash. And it's not until we look back and reflect, we see that what we did achieve. And I think that sometimes, and it was always had to be in that sense of hope as well. So I think endurance can't come without a sense of hope. So yeah, that was kind of my kind of perceptions of, and continue, but particularly at the start of the pandemic.
Thank you, Nicola. Thank you. And you're right, you sort of need to hold something in your head. Like in endurance, you need that other sort of,
Sorry?
You need that other pole, don't you? That other
yes.
piece of hope to get you through. Philip, do you want to, do you have some reflections from your perspective?
Well, just picking up on the collaborative approach, when I reflect back on my clinical time, and it was pre-COVID, the thing that really kept me when things became stressful was that collaborative approach, the teamwork, that the whole team supported each other. And so if one person was having a difficult time with a patient or a situation, the rest of the team basically moved in to support them, and would not be critical, but would give constructive advice. And it was really interesting to compare that with our advocacy campaign, which hit a lot of roadblocks during the COVID outbreak because we couldn't have face-to-face meetings. And what really surprised me was that I thought that I was starting this campaign to improve the funding and resourcing in Western Sydney, but these people came out of the community, and they were the energy. I was the face, but they were the energy. And again, when we hit roadblocks, when we hit difficult situations, it was like a family coming together, and someone else would take over, that. And I think there's a real comparison between the palliative care teams that we're also used to and what I discovered during the advocacy program, that it wasn't left up to an individual. It was very much teamwork. And that was the endurance part of it, that when you started to flag, you had people propping you up and supporting you, and at times leading you. And I really appreciated that.
Thanks, Philip. Thank you. Danielle, you've got sort of the finger on the pulse of the community. Your thoughts on endurance, and is that an applicable term from your perspective, from where you sit?
Yeah, look, I think if you look at it, all the community organisations supporting people with cancer, we really had to lift in a way that we hadn't been required to before, because the health system was under such duress, and the patient experience stories that were coming to us. And Nicola mentioned particularly around the impact of visiting. And, you know, visit is an interesting word when you think about the support people provide, particularly at end of life. It's not a visitor, it's someone who's providing that emotional, practical and informational support and holding families together. And there was complexity for community organisations because we saw the duress that health professionals were under and the system was under, and we had to empathise with that as well as empathise with the patient voice. And so I think that endurance for us, we didn't know back in 2020 that, you know, we're still going to be here talking about COVID, you know, full 2 years later, even, or coming up to 3 years. And we've been looking at some of the fatigue in the community, and not just in patient community, but in health professionals, and the overwhelming emphasis on COVID. I think our team did some investigating, 2.5 million distinct news items about COVID in 2020 alone. So the community saw what was going on in health. But when people were having that lived experience, especially, as I mentioned, at end of life, the support just wasn't there for them in the way that they would have expected it, or, you know, people wouldn't have had an experience unless they'd supported someone else towards ends of life. And so I think that was really the community organisation's role was to be able to provide that support and that conduit for people who couldn't be the eyes and ears of their loved one. And, you know, 2.5 years later, we've put new processes in place. But I think the fatigue that we all talk about, not just COVID, bushfires, war in Ukraine, cost of living, we're still seeing that impact. And so I think for endurance, it's about how do we make the greatest impact with the resources that we have. And at the moment, some of that resource focus is really about supporting people's mental health needs. We know people can't get psychosocial support. We know people didn't get bereavement support, and we're still managing people who have that duress of not being able to be with someone the way they expected at end of life. And so I think endurance is using scarce resources for the greatest impact. We've just done a community survey of over 300 voices, including multicultural voices, of what were the greatest unmet needs in the pandemic. And there'll be no surprises that impact of visiting, it just stands out. And I think we're going to have long-term psychological impact for many people. And so our endurance is about how do we continue to support that unmet need.
Thank you. And you rightly point out that this is an ongoing sort of phenomenon. I mean, COVID's still ongoing, but the fallout from COVID and all the pieces that sit around it. Michael, your reflections?
Yeah, thanks, Jen, and I really appreciate the contributions of everyone else as well. I mean, very, very similar experiences on lots of fronts for me and for my team and for our community here in Canberra. And I guess one of the things that, in thinking about this, in preparation for today, one of the things that really stuck with me was reflecting a little bit on the sorts of things that we've been hoping for as a community, and particularly around this notion of a return to normal, which I think really speaks to that sort of sense. I think that lots of, Nicola's comment about a sense of the importance of a sense of hope, I think that's been central to many people that I've spoken to. What they want is they want all this to go away. and how does that happen? It's about returning to how things were. And I, particularly in thinking about it, it's amazing. There was a lot of focus around the sort of metaphoric elements of this in the media within COVID. Lots of talk about races. It's not sprints, it's marathons and all sorts of things. But the thing about that, isn't it? The thing about a race is the race finishes, and at the end of a race, everybody goes home. But that's not the situation we're in. And I think, coming back to Danielle's point, certainly my experience and my impression, both in terms of the actuality of some of the challenges that we're facing against, COVID, climate change, continued worsening inequity, across the globe, that they are continuing experiences, but continuing experiences with an ongoing impact. And for me, then that comes back then to this notion, well, what are the hopes that we really have? You know, if hoping for it all to go is actually not necessarily a very realistic one, what are the sorts of hopes that we should actually be looking to foster? And for me, this, Jen's, your description, Jenny, about what endurance could contain, this kind of idea of this notion of sort of growth or response or progress. To me, I think for endurance for me in 2022, that's been really central, this idea that maybe there are more things we can hope for, and maybe hoping for a return to normal isn't actually desirable or possible. If our normal world that we had pre-COVID had all of these things in it and these kinds of problems, maybe we should be aiming for a little bit better than that. And maybe that's, to me, a sort of a central idea of endurance, a sort of a sense of a commitment and a recognition, which, if I can say, sounds very similar to palliative care clinical language. If in fact we've got these insurmountable problems that can't go away easily, what are we going to do to make sure each day is as good as it can be? And how are we going to work collaboratively to achieve that? And so for me, that's really central to the notion of endurance for me now.
Thanks, Michael. And I was struck with all of the others talking about the same thing, although curiously I hadn't really thought about it in this way before. But Philip talking about the team and how the team is clearly an important thing, and the new relationships and the possibility, and as you say, how do you reframe hope, perhaps, or how do you, if this is not going away, how are you going to go about it? Yeah, thank you. So that's been really rich to begin with. Thank you, and it's just going to get better. It's interesting in the perhaps in the pop culture, there's a bit of a resurgence of interest in the Stoics in this time. And the Stoic philosophers, as people will know, sort of have got the gold standard on endurance. But at the heart of their way of living is this notion of self-control and clear judgment and overcoming destructive emotions. And this is not about having a stiff upper lip. This is something a bit more than that. It's around, in fact, to quote one, it's the resolute will to face the world with an unbroken gaze and to maintain personal integrity when everything else is chaotic. So I think that's, a very interesting thing, because it's not about not being attentive. It's not about not understanding the depth of emotions that might be around, but it's around having a level of self-awareness and other awareness. And I did have a quote which I took out, but I'm going to put back in, and I took it out because it was all too long and I'm talking too much, but it was so rich. This is so Seneca was one of the Stoics, and he wrote a letter to his mother on the subject of grief. And as I quote the translation, "So I was waiting until your grief of itself should lose its force, and being softened by time to endure remedies, it would allow itself to be touched and handled." It's a very attentive and thoughtful thing, and it's not a stiff upper lip. It's an awareness and a respect for the space. So there are these 5 principles that the modern people writing about this say is part of Stoic, and this is a slightly pop psychology language, so forgive me, but it's easy to understand. So these are: manage your expectations and judgments, be realistic about what you have the power to change, understand the meaning of equanimity and practice it, call out your emotions for exactly what they are, and live in harmony with nature, particularly human nature. Do any of those ring true to you, Danielle?
Yeah, thanks, Jenny. I think I had to look up what equanimity meant, but then I realised that it was calmness and self-control, and how do you practice that? And I think about that when I think about our 13, 11, 20 nurses. So there are nurses who are taking those frontline calls, over 10,000 calls a year, and many of those calls are people who are in despair related to whatever their experience is around cancer. And we've been doing some research with RMIT, looking at some AI algorithms over about 60,000 transcripts throughout the COVID period. And one of the findings was that the emotions of the callers is replicated in the emotion of the nurses. And that was a really significant finding for us, to think that when our nurses are dealing with all of that emotion, whether it be anger or grief, that those emotions, those negative emotions, can be replicated in our staff as well. And I think that that really resonates with me, because our nurses always display that calmness and self-control, but what are they taking home? And particularly working, at home during the pandemic, instead of in an environment where they could lean on one another. And if someone was taking a distress call, and it might be, it might be a suicide call, it might be someone talking about, significant issues, very personal issues that can, domestic violence. Our domestic violence calls were exacerbated during the pandemic. And a fellow nurse might overhear that and come and sit with them and debrief with them. But when you're sitting at home in isolation, you don't have that support wrapped around you in the same way. And I imagine for some health professionals, that would have been an experience on the ground as well. I remember early in the pandemic sitting in a webinar where some of the palliative care team talked about their nurses changing in the front garden, washing their hand under the garden hose to don and doff off their PPE. So for me, it is the incredible nature of the people that work in this space. But for us as employers, to have to really think about that health and well-being of our staff, and how are we supporting that in these really difficult times.
Thank you. And finding really creative ways to create that support that would just happen sort of organically in the usual
Absolutely
circumstances. Yeah.
And for us it was morning, afternoon, and evening huddles, and I think those huddles are those wrap around, put your arms around each other, even if you're doing it virtually.
Yeah, thank you. Philip, you got comments on the roadmap to Stoic philosophy?
Yeah, the first two really sort of struck a chord: manage your expectations and judgments, and be realistic about what you have the power to change. When I was the director of the service, our focus had been on trying to re-establish inpatient palliative care beds, a dedicated unit which had been closed. And as a director, you're really restricted in what you can say. Part of your contract of employment is you can't speak out. And I realised after retirement that was now no longer an issue, that as long as I was sure that what I was saying was 100% correct, that what I was saying was not putting those still employed at risk, then I could say in public, in the press, be honest and give those opinions. And what was really interesting was that the team who were doing it so tough over the last almost 3 years with COVID regularly fed back to me that the efforts by the community to re-establish appropriate services in this hospital was one of the things that kept them going, so that they saw the community support for what they were doing, the recognition of what a great service they were providing under such difficult circumstances, and to be able to achieve that in the end, to get this service re-established, was really rewarding for the team, most importantly for our patients and their carers, but also for the community team who have pushed this so hard for so long. And so at times when I was employed, I thought that the expectations were probably unrealistic. Once we really got into it and I was retired, we were really realistic and we were convinced this was going to happen. And the interaction between the service, the palliative care providers, and the community was just amazing and really rewarding to see that.
Thank you. So that's really interesting, isn't it? Because be realistic and about what you've got the power to change, but also you can readjust your expectations as well as you see that sort of really evolve. So you be be bold as well, I guess, would be.
One of the lighter moments was one of my contacts told me that the executive had labelled me as red, retired, and extremely dangerous because I could actually speak out, where the team themselves couldn't speak out. So that was a moment of humour as well.
Yeah, and liberation. How wonderful. Michael, have you got thoughts on this or you wanted to add to this?
Yeah, so many, Jen. Yeah, just responding, I think just to Philip's comment before about, I guess one of the other things that really speaks to me about is sorry, I'm just getting peppered with calls in the background, is that actually the impact that we have, or the impacts that make big change, sometimes aren't the impacts that we expect. The things that create the influence, create the waves that lead to something really, really tangible and really important, are not always the things that we think will be. And as you said in my introduction, just introducing me, Jen, I'm really interested in this notion of systems, how systems work, and hospitals, communities, families, even us as individuals, we're all sort of different kinds of systems, and actually systems are very responsive. They're very influenced by all sorts of different things, but predicting exactly what it is that will influence things is really difficult. And sometimes I think the art of influencing a system probably does come back to this notion of endurance. It's about continuing to try and having an appetite and an enthusiasm to be creative and try new things, even if the new things actually end up seeming very, very simple. I wanted to just specifically just talk about equanimity for a second as well, if I can. I think it's such an amazing word that I think includes so much. And I was thinking about what equanimity means for me, and for the sort of performative aspect of the kind of care that we I think, palliative care clinicians and those involved in providing healthcare often do. And I was thinking about this. I was spending some time with a patient this week, I think it was yesterday, who was dying, a young man who was dying of a brain cancer. And he was lying in his bed, and I was sitting there next to him while his wife was on the other side of the bed, and we were both holding this young man's hands, and she was serenading him. She was singing him his favourite song. And it was a moment of incredible beauty and amazing tragedy at the same time. And for me, the sense of being able to participate in that, but also as a healthcare provider, need to walk into a situation like that sort of afresh and be present, and then also to have the capacity to recognize how important that is, and also let it be as you leave the room and move on to something else, to me really speaks to this notion of equanimity, that it's not necessarily a not feeling, but it's a recognizing that in the sort of feeling that we all must do as part of just our human experiences, and also as part of the provision of care, to be able to be really effective for ourselves and for everybody else. We have to be able to sort of continue to move and be present with whatever the new thing is now. And so I share that because I think it is really, really important aspect of who we all are together, and certainly an aspect of what it is to endure. But I think as well, one of the things that I think has been really challenging about providing healthcare in the last couple of years has been, we've talked about this a little bit already, about some of the kind of moral distress or the challenges associated with the feeling that healthcare's focus has slipped a bit away from actually care provision and more onto a variety of other priorities that are important, but maybe don't feel quite as important to healthcare as is actually caring for the person in front of you. And I think equanimity is kind of really central to how we know that those things are really important, and how we feel them and how we abide with them.
So it sounds like the way that you're describing it, which I don't disagree with, but it sounds like, so equanimity is very intentional. And I wonder if also it needs to be practiced and learned. What do you think to that?
Was that to me, Jen? I'm not sure if that was, or if you said to Philip. Apologies. It was to me. I mean, certainly to me. Yeah, I think that equanimity for me is something that I think we all have the intuitive capacity, innate capacity to do this. But I think actually working on it makes it much easier. And I actually have little practices for myself that I do to help me do that. When I, particularly for a healthcare provider, it's really, we've got to wash our hands a lot. And so if you ever try to remind yourself to do something around the bedside, it's really easy to tie it into sort of all of the hand washing. So I try and remind myself when I go and see a patient, when I'm doing my hand washing, to sort of really arrive and really be present as sort of an entry, sort of to get into the sort of space of being with a person. And I also remind myself at the end of seeing a person when I'm doing the same process to wash my hands, is to sort of recognise that I've given what I had, I've given my best, you know, for that person at that time, for the time that I had, and now that's allowed to finish, and now I'm allowed to move on to the next thing. And so for me, it is a very intentional practice. It's something I've really worked on, and I think it is something that's easier to rely on if it's something that you do kind of work on in different ways.
Thank you. I love that you link it to the hand thing. Thank you. That's very poignant. Nicola, do you have thoughts on the tenets of the Stoic philosophy?
Yes. Well, I too feel it really resonates with me is, you know, the notion of equanimity as well. And I think when we're in periods of high emotional and moral distress, we do look for others for guidance. And often how they respond sets a tone of how we will respond, similar to what Danielle had said and also Michael. And I think that's so much a part of palliative care, but in general, as you know, a human being, in the way that we interact and respond with one another. I think it does very much can set that tone, but I think too it is something that we need to practice. It's something that doesn't often come quite naturally, particularly when we're ourselves in really stressful situations. I think it does, you know, provides that guidance and direction for people to enact, and you know, it does empower as well. There's an empowering and an enabling as well when that is modelled. So for me too, I think that's something that, and particularly from our leaders, finding that from our leaders that we turn to, if they are practiced in, you know, in the equanimity, then too that it enables us to model that similar behaviour. So for me, that's something, yeah, that really resonates.
Thank you. Dr. Das from India has joined us, and I don't know if Dr. Das is a he or a she. I'm sorry, Dr. Das, but you have raised the notion of a strength-based approach amongst communities. I'm just wondering, would any of the panel have thoughts about that, or would like to comment on what that could mean in your setting? I think you've sort of touched on it a bit already, perhaps Philip and Danielle, in how you responded, but any thoughts on this? Or how we could harness this further?
Just in response to that, just a reflection on a particular case, and it's what Michael said in terms of focusing on what an individual patient's needs when you go in to talk with them. That so often clinicians have this balance between patient-focused care and the needs of the service. So if there's a lack of a bed, that often you feel that a patient is well enough to go home, and you go in to assess the patient and at the same time try and persuade them to agree to be discharged, when the focus should be on that individual patient care. And I had a patient who taught me a very good lesson, that we'd stabilised his pain control. We felt he was fit to be discharged. He wasn't accepting that. And so I foolishly said, well, actually, one of the problems is we have a patient who is like you in emergency. We haven't got a bed. If you're able to go home, we can bring this patient up and sort out his pain. And the patient, without flinching, looked at me and said, Dr. Lee, that is your problem. Don't make it my problem. And that was a really good lesson to me, And I had a bunch of students there who all, we went outside and I had to debrief because I knew I'd made a mistake. And so the lesson was taught to me by the patient. And this happens so often. And so trying to maintain that patient-focused care, and as Michael said, keep that almost in isolation while you're seeing the patient and deal with the other issues outside that. And as the patient said, don't make that the patient's problem. And you get these lessons all the time in clinical practice.
It's very humbling, isn't it? Thank you, Philip, for sharing. Any other reflections on either strengths from our community or harnessing sort of more broadly as perhaps what might be called a strengths-based approach?
Jenny, I think that the power of the patient experience is you know, how do we harness that? Because it's such rich data for us. And I think we can see it in community organisations. Health services have access to the consumer experience through their consumer boards and panels. But what I think we didn't do well in the pandemic is actually use that voice to help us set our priorities and to think about the processes. So we knew that we were still hearing of the incredible distress right throughout. You know, we never changed the dial really on visiting restrictions. It was worse. There was inequity. It was worse in some places than others. But I think now, how do we use that consumer experience to go forward and to better prepare? Do we have disaster preparing? We've talked about all the disasters that exist in the environments in which we're practicing. But what do we actually do with that patient experience to better shape and to try and support that moral distress that we heard so strongly from clinicians?
Yeah, thank you, Danielle. To come up a little bit around this sort of, we've learned a lot and there was some creativity and new relationships enabled by this. So how do we really harness that? Thank you. Michael, yeah, do you want to add?
Sorry, Chair. Yeah, well, I'm just really agreeing with Danielle and Philip, and I guess, you know, extending and maybe repeating Danielle a bit, but extending Philip's notion about, you know, care being for the patient. You know, healthcare exists for the community. You know, we work for the community, and the community, you know, on many levels, ultimately are the best arbiters about how healthcare should work. But we aren't particularly good at involving them and supporting them to have the voice that they should. And I think, you know, conscious that I may be misinterpreting the intent of Dr. Das, but the strength-based approach to me acknowledges that actually, you know, there is an incredible strength and depth of what people can bring to the complexity of situations, even if they're categorizable as having an illness or disease in inverted commas. That there are many strengths and many things that they can bring to play. And so I think one of the things that we, you know, palliative care and healthcare more broadly should be, and hopefully will continue to actively explore, is to try and redefine, you know, how care should look along with the community, to make sure that the care that we're providing is the care that the community really thinks is needed, and not just the care that we're used to providing because it's the sort of care we've grown up with and trained with.
Yeah, thanks, Michael. So I'd like to perhaps take that idea a little further and explore a bit more about the possibilities of endurance. And I guess we're talking around this already, creative new ways and listening as opposed to doing it the way we've always done. But there is perhaps a long association of endurance with the resistance and protest, and we've all seen that, including in our own lifetimes. But I found a quote from Frederick Douglass, who is the American abolitionist, indeed a former slave, an orator and writer, and he said that the limits of tyrants are prescribed by the endurance of those whom they oppress. So in this way, to endure is to limit the power of those who are potentially doing the oppressing and applying the conditions to be endured. So endurance maybe can lead to victory in that sense. And, you know, in some ways we've seen that in Black Lives Matter, although, you know, that's still playing out. But thinking about possibilities and thinking broadly and thinking creatively and wonderfully as we have, I wanted to ask you to finish, to each perhaps comment on the quote from Charles Dickens, which was, "The men who learn endurance are they who call the whole world brother." Nicola?
Thanks, Jenny. Yeah, I suppose when we think of, you know, we were all forced to live within a containment that was not of our own choosing, and often it was in that context of fear. So I think we've lived through something monumental that's irrevocably changed us. And when we were talking about hope previously, it is the hope, but how we actually now adapt our expectations of the hope we once had. How do we then transgress that into the future? So I think we all have lived so fully. We've seen the depths of great despair and then also the glimmers of joy. So I think during that time, there is often, you know, we do learn to live more generously and fully. And I think, you know, things such as, you know, perception of yourself and perception of others change. And also, I think it highlights the fragility of life. So, you know, in those processes, we often do, you know, we open our hearts and minds and give more, I think, in those periods of when we've had great distress, but we've actually moved through that and endured that, and things may be irrevocably changed. But there's that sense of how much we actually did achieve and how much we continue as, you know, globally really to address this and these ideas of creativity and collaboration and all these new partnerships and all our have revolutionized so many of our processes in healthcare. I think that does, it just opens you more to the possibilities of what, you know, what we can achieve. And it is that we do, our hearts are fuller for it, I think.
Thank you, Nicola. Thank you. Danielle, the men who learn endurance are they who call the whole world brother?
Thanks, Jen. I really had to draw in my inner self to think about this quote, and I had a look at the full quote. And part of that quote was feeling broken when I should have bent. And I think that's how I think about endurance and what supports can we put around people so they don't break and maybe they are going to bend. Of course, they're going to bend with all those extreme challenges that come with acute illness. But it is about having supports. And I see our role at Cancer Council as really being fundamental to that. What can you do to ensure family is supported, even at times where they can't be with a dying loved one? And I think there was also part of that quote was when you turn away from support, you pay the price. So for me, it's what supports can we put around? What's the wraparound that we can give to people? Because to endure, you can't endure by yourself. And I think that's true for us as health professionals as well as it is for patients.
Thank you. Thank you indeed. And Philip?
There's so many aspects to sort of learning endurance. And again, it sort of comes back to the team with the advocacy. It was the team around me that when I started to tire, it was the team that sort of pushed me back up and the rest of the team back up. And they basically became my brothers and sisters, you know, through that whole process. The other aspect from my own personal point of view is the work-life balance, whether it was while I was working, the work-life balance, or now I'm supposedly retired, my commitment, life balance, I think is so important as a preventative measure to make sure that whatever your life interests are, whether they're exercise, walking, relaxation, whatever, that you don't lose sight, that you do need to have that balance within there to keep you relatively stable as well. And without that, if you just totally commit to to work, then at some stage you will fall over. So you need that way of relaxation. My therapy at the moment, when things get stressful, is to take the dog for a walk, and she totally takes my attention. And if I don't take it for a walk, she reminds me it's time to go for a walk. That work-life balance to me is just so important for everybody.
Thank you, Philip, to help us bend and not break. Michael?
Yeah, thanks, Jenny. I mean, to me, it's it's an amazing quote because there's so much in it. But I think the thing that really resonated with me first reading this was around this kind of notion of vulnerability. And I think Nicola may have talked about this already. That part of the reason that endurance is so important is because we're all fragile in, I think, Nicola's language. We're all vulnerable. We're all at some point going to get sicker and we're going to die of something. We're all dependent. If perhaps at particular points in our life when we're very young and we're very old, we're very clearly and obviously dependent. But at every other point, we're highly dependent on everybody else all of the time. And these are really, really old and fundamental lessons that have been available to us for a long time, but we probably really haven't quite learned them as deeply as we need to. And so there's lots of creative thinking that's required about what endurance means now. But I think to me, actually, the thing that we ultimately need to take on is some really, really important ideas about what it is to be human on this planet. And for me, as I said, the sense of our shared vulnerability, universal vulnerability, actually that we're all in this together, and there is nothing separating us in the sense that these kinds of constants, these kind of realities, are something that we all live. So I think for me that's what really comes through with this quote to me, and that makes endurance so completely necessary for all of us, but also a completely universal pursuit that actually, both in the spirit of our vulnerability and our fragility, but also in the need and the actualized potential for us to do something about it. We are all in this together and will continue to be in it together.
Thank you, Michael. And it draws us to the end of the panel. It's been a really rich and wonderful and thoughtful and moving and ennobling discussion for all the things that you have all done over the last year, and the people watching have all been doing over the last year, over the last many years, but I guess particularly we're focusing on the last year. But I really thank you for sharing your thoughts and for thinking deeply about this notion of endurance, and for unpacking it, for I use the word ennobling. I think that's sort of what it can be when we embrace what is available and think deeply and carefully about this and how we best provide care and how we best respond and care for those around us, including our colleagues. So thank you, Nicola, Danielle, Philip and Michael. It's been a great pleasure hosting you today and hearing your ideas. Thank you also to Tanya, who has yet again brought all this together and got us all here on time and managed the whole system and for the whole year for organisation of this. And thank you also to you, the audience, for coming along, for being part of the Perspectives and for particularly being part of today and contributing today. Wish everyone a great summer and time with the people that you care about, and lots of festivities for those who are feeling festive. And we look forward to seeing you all again next year. So bye everyone, and thank you.